Good afternoon. I'm Maurice Crespi. I'm the managing partner of Schindler's Attorneys. But importantly, we are COBRA. We are here today to present. There will be a presentation by Singular. I'll start off by just introducing you guys to COBRA. COBRA is a non-profit organization. The idea is that we collaborate, we take a set of skills, we pull them together, and we assist society and we assist businesses in the predicament that they currently find themselves in. So what we've done is we set up webinars, informative webinars, to deal with different aspects of the situation. We have daily webinars at 10 o'clock each day, which deal with business rescue and the business rescue process and the various funds. So I'd invite you to please join those if you want specific information in relation to business rescue. We also have webinars in relation, specific targeted webinars in relation to labor, the relief funds and the like. Importantly, if you want a private session with any of the partners, with the COBRA team, we can arrange it as part of the pro bono service, so there's absolutely no problem. COBRA has grown in the last 3 weeks. I don't think there's an entity that's grown as COBRA has. I've lost track of the partners that have been onboarded, the partners who are onboarding, and why. For the simple reason that we're here to assist, and we're here to do whatever we can to utilize our expertise to see how we can mitigate the adverse effects of what we're experiencing at the moment. So what happened was Adam Cracker of the IQ Business Group, he's a good friend of Schindler's. We, together with the consortium partners, came up with a vision, and the vision's being executed. So I'll start off by introducing Adam Cracker. He is a panelist. He hasn't told me, but I had to do some research on him. He's a writer. He writes for Daily Maverick. He provides opinions, again, to the press. He's been a group executive of Dimension Data. He's been with the IQ Business Group since 2009. He's been at Accenture. And he's really the driving force, in my mind, behind what you're going to, well, what we're witnessing today. He's been absolutely brilliant. And I think on the COBRA team, I'd like to take this opportunity to thank him, because he's really made a difference within COBRA. And having made that difference, he's also done it by introducing YPO, the Young Presidents Organization. And the Young Presidents Organization, let me start off by saying that we're indebted to them. What they've brought to the table is absolutely fantastic. They've got an initiative of their own. They're aligning themselves with COBRA. And since their involvement, you've seen dramatic changes in, wow, the skill sets and the individuals that we're interacting with. But importantly, the shared knowledge that has become available to the public is just remarkable. On Singular Systems, they're going to be presenting, or Singular, sorry, I mentioned Singular Systems with our client of ours, but this is Singular. They're a managing consultancy. They are into strategy and investment decisions. Adam himself has said that they're the very best market-specific research available to forecast the scenarios and macro situation that is leading to the need of business rescue. So we have, once again, within the COBRA environment, expertise. Who do we have with us today? We have Lorenzo, we have Annalie, and we have Alina. Now, Lorenzo, he heads up Singular. He's been involved in various countries, companies and countries involving Russia, Latin America, and he's got a bachelor's degrees in industrial engineering, and Singular is his, and his expertise is unique to the COBRA environment, and we welcome his expertise. Hence, we have him today. We also have Annelie, who's a manager at Singular. She has a master's in chemical engineering and has spent her career supporting African businesses and strategy and organizational transformations. So, no doubt that Nadine is she's certainly branching out, and this is exactly what you want to do. So I'm going to hand over to the panelists. I'm going to ask that Lorenzo introduce himself. Lorenzo, welcome to COBRA.
Thank you. Thank you, Maurice. Can you hear me? Can you hear me well?
I can hear you very well.
Super. Fantastic. So thanks a lot. I mean, I will jump directly into it and try and sort of use the time in the best possible ways for all of the people that are listening. So the idea today, and in the meantime, if we don't mind starting on the presentation, Aline, you can start screening or sharing the screen. Yeah, I mean, we've all sort of been overwhelmed by something in a way bigger than us and bigger than what we've been ever witnessed or experienced, certainly if you want, within the last generation. Now, what we're trying to do as a part of this pro bono initiative is really trying to pull together from a different number of lenses and perspective the information that you see and you will be overflown in the media, and try to sort of derive some conclusions and some inferences, and we'll be always very honest and straightforward on whether because right now, I mean, let's be clear, there are a few known facts already about the virus, about the economy, about the reaction of governments, but there's still a hell of a lot of unknowns, what we call the known unknowns. These are sort of wild cards that we're very open and straightforward about, that will influence how COVID and what impact COVID will have on the healthcare system, on our health, on the economy, and on our businesses. At the same time, we would like to very much make this as practically as possible useful to all of you business leaders and businessmen and businesswomen to make the best of it, in the sense of to minimize the damage and hopefully even turn the threat into an opportunity if possible. Now, just going quickly into this is a weekly sort of piece of work that we share. This is the first time we share it with COBRA, but we'll share it publicly, and we have shared it since last week. We will keep on doing it and given that CEOs and global leaders around the world are actually finding it useful. We have different issues on different countries, and this is the South African one. Now, we don't necessarily need to go on to what we said this time vis-a-vis last time. Let's rather straight away go into our agenda. Yeah. So we'll structure this conversation in three parts. We would like to sort of have 40 minutes of presentation and then a 20-minute Q&A, which hopefully is the most useful of all, because we even in a limited amount of time, it allows us to sort of give you some practical indication that are specific to your business. Now, in particular, what would we like to touch upon in this 40 minutes? Three areas. One is what is happening in the world, but especially in South Africa, when it comes to a virus and the healthcare perspective. So in other words, how could COVID develop and unfold in the country, based on what we know so far and what we know from other countries? Point number two, what could unfold in the next few months in the economy? So again, what could be the first to second degree implications from an economic standpoint, from a macroeconomic standpoint in the world and therefore in South Africa? And again, what can we learn from others? And then thirdly, what are and how are business decision maker and consumer behavior changing right now, but especially what could change for good, and what could manifest itself into a permanent change, a permanent shift that will actually make the business environment out there different for all of us as business people in the future. Now, I have to start by saying that I have for you guys, I'll start a little bit with the end in mind. I have for you guys 2 good news and a bad news. And these are as follows. Number one, and we'll touch upon it on the healthcare and virus part, the virus and the sort of healthcare related situation is possibly not as bad as we all thought initially it could have been. Now, this doesn't take anything away from the tragicness of any casualties. This only makes a statement vis-a-vis the extent to which the impact could have been foreseen given the first few weeks of the virus. So I'll keep given that we're jumping into this slide, I'll keep the bad news and the last good news for later. And I'll start with this good news. So now, if we look at page 9, we look at the fatality rate. So I'm telling you guys, I'm telling you all that, let's say the impact is sort of better than we thought, or not as bad as we thought. Why am I saying this? I'm saying this because it is clear, or it's becoming clearer and clearer that there is a sort of a pyramid that you COVID-19 pyramid on the left side of the slide, which shows more or less qualitatively the ratio between the casualties, which is what typically comes up in the news because it's obviously affecting all of us and it's most self-evident, the severe cases, the symptomatic cases, so basically part of the population that has tested positive and or is positive and has symptoms, and then asymptomatic or mild cases, which are basically positive to COVID, but they either haven't been tested because they are asymptomatic, or they are asymptomatic, and let's say they would be caught only if a country, which has been done only very rarely so far, would be testing randomly the population. Now, what does this mean? This means that for every 1 case reported, more or less, there could be anywhere between 4 and 7 cases undetected. Because of the shape of this pyramid. What this means is that the virus is a hell of a lot more spread. This is globally, and we assume that the same applies to South Africa, obviously proportionally to the number of cases. And this means that the virus is a hell of a lot more spread than we think, and that it's reported by the media. Now, we don't say this just because Singular thinks this. We say this based on a number of, Lancet studies, a number of other, let's say, academic John Hopkins and so on studies. And we start seeing this also empirically in the data. If you look at cases, for instance, like the Diamond Princess. The Diamond Princess was a cruise ship, one of the first few places where the virus actually broke out. And what we could see there is and that's the closest it gets to a laboratory-like experiment, because everybody's on the cruise ship, most people are exposed to the virus, therefore many people caught it. And of those, we could see what the mortality rate was. Now, in that case, it was actually on the higher side of the range that I'm about to tell you, because the average age on the cruise ship was particularly high. But that gives us a data point that is consistent with what we're saying. On the other hand, you have countries like Iceland, for instance, that have tested to date around about 10% of the population that confirm these ranges that we in a random, so it's a randomized based testing that confirms this range. So what are these ranges? We estimate, if we age adjust the global numbers to the South African sort of average age, we age adjust it to 0.4 to 0.7%. Now that means that for every 100 cases, sort of 0.4 to 0.7 would be the likelihood or the mortalities. Now, this is obviously extremely skewed towards the elderly, and that's why South Africa is actually on the lower end of the global spectrum, because South Africa has a young population. You can see the distribution on the right side of the slide at page 9. On the other hand, obviously, there are a few sort of wild cards which have to do with the sort of health condition, especially HIV positive patients that are not on antiretroviral, and people that don't have access to sanitation, etc., etc. So there are a few caveats to the which also make us be a little bit more, let's say, conservative in the estimate. Just to put it in, then I'll conclude on this slide, but to put it in perspective, what this means is that the mortality rate is round about 4 to 6 times less than the Spanish flu, which is the big sort of influenza that at the beginning of the last century sort of hit especially Europe. And on the other hand, this would be 4 to 7 times more deadly than a normal flu, than a normal influenza, which is obviously a lot, but still not, let's say, to the level of the global pandemic of human mankind. Okay, let's move on. Now, what we can observe is obviously that we can observe in page 10 is that the trend that we observe in Italy and China, these are just 2 examples, typically spikes roughly weeks after lockdown. That is due to mostly 2 reasons. I mean, one is that typically the number of tests increase, so you start testing more, and therefore you find more cases. And number 2 is that you have there's a time delay. There's a 14-day incubation and time delay between when you contract the virus and when the virus manifests itself. So what that means for South Africa is that we can and we should actually expect, unfortunately, an increase in number of cases, which and we will see it in the data later, but to a big extent, we haven't yet observed, which is an excellent news. Okay. In terms of, so obviously you only find what you're looking for. So it's all about testing. It's all about how broadly you test and how sort of randomized is the testing done. Today, South Africa is roughly testing 1 times less per day than the US. And 4 times less than South Korea was at the peak. Now, this is just to put it in sort of relative context. What does that mean? It means that we absolutely need to continue to, as a country, to step up in the testing and tracing, because otherwise we will only see the consequences of the virus after lockdown ends, because of this 14 days delay. And in any case, without any testing and tracing, it's impossible to detect the extent to which the virus has hit. Okay, I'll move on. Needless to say, the number of, so the mortality of the virus depends not only on the virus itself and on some potential characteristic of the population, which we'll see later, but also on the, let's say, how prepared the healthcare system is. That has a dimension of testing, which we spoke about, has a dimension of tracking, which is all about whether you actually identify who possible, let's say, who infected people have interacted with, and then isolate those, which has been done quite widely from, I see from Maurice, are there any questions? No. Okay. That has been done quite widely by South Korea, especially with using regulations that are not necessarily in line with what typically is done in, or could be done legally in the current legal framework in South Africa. But that was absolutely critical for them to be able to not lock down the country. Then, of course, the lockdown and infection management is a key critical variable, and the healthcare system readiness is the last critical variable. Basically, how many critical care beds are there on a per capita basis? Now, that number, if you look South Africa vis-a-vis, for example, USA and South Korea, South Africa is actually quite in line with South Korea, a lot below the US on a per capita basis, but that number typically, as the crisis unfolds, we should see that number increasing, and therefore making it less of a bottleneck. Okay. You can move the slide. This slide shows basically the evolution of the number of deaths, so which is the best proxy we have for the virus. And what basically shows is that we have, again, a few weeks after lockdown, most of the European countries are slowing down in the rate of death. This is a rolling average to smoothen a little bit the peaks. And what it clearly shows is fantastic news, which is that so far, let's say the growth in South Africa has actually been, even though I need to acknowledge that the virus hit later than Europe and the US, the growth has definitely been less impressive so far. Okay. Now, how does the situation look like when it comes to let's say the number of cases and the number of tests and the number of deaths? This is sort of the picture to the 16th, 17th of April. And as I said, post-lockdown, instead of seeing a massive, let's say, growth like we've seen in many other countries, we can actually mildly and conservatively be happy that the numbers did not yet spike completely out of control. Now, again, I will not stress this, I cannot stress this enough. This depends very, very heavily on how much testing you do, because you will only find what you're looking for. Now, of course, the number of deaths should be in any case an indicator of that. And therefore, so far, I would say we can be mildly, let's say, happy about the fact that the numbers look in relative terms a lot better than elsewhere in the world. Okay. And this slide basically does a simulation of what, if this spirals out of control, South Africa, and we took Italy as an example, South Africa would need roughly 26,000 ICU beds to be able to cope with the peaks of serious cases. It only has roughly about 6,000 to 7,000. So that obviously would be extremely hard to manage. And that's why we endorse and we are supporters of lockdown, especially as an initial harsh measure to prevent something like this from happening. On the other hand, if it's managed particularly well, and so we took the South Korean, for instance, example to simulate how South Africa could evolve. That could only mean that South Africa would need only a few hundred actually critical care beds, which is way below the capacity in the country at the moment and in general. Okay. So as I said before, I mean, there are a lot of unknowns still. So let's say, fool ourselves that we understand everything about the virus and our predictions will necessarily materialize. The biggest unknown we see, I mean, there's a few global unknowns, some on the positive side, some on the negative side. Some are global and some are more specific to South Africa. Now, on the global side, clearly the vaccine is a big unknown, although most experts say that to have a mass marketed at-scale vaccine less than 12 to 18 months before the virus, or since this virus started spreading in January, would be rather, let's say, ambitious and unrealistic. So let's keep that in mind. Of course, as a negative driver is to what extent this virus mutates, because if it mutates, of which there is some evidence, if it mutates, then what that means is that even after contracting the virus you could catch it again 1 year after, depending obviously on the speed of mutation. Seasonality is another driver. Now we see that the Southern Hemisphere has been to some extent magically, so to speak, and not because it's magical, but because the world still is looking for what correlations and what factors are really explaining it. But one of them could be the weather conditions in the southern hemisphere that make it such that the virus spreads a lot less. I mean, if you think about normal flu is actually a seasonal virus. Specific to South Africa, of course, good news, early intervention. South Africa intervened very, very quickly. It had the benefit of being a late mover because it saw how the rest of the world reacted to it. The BCG vaccine is also an interesting potential, let's say, positive driver. Why? Because we can actually start seeing some correlation between countries that this needs to be obviously verified by properly done studies, but anecdotally you see some correlations between BCG, so countries that had the inoculations for TB and the spread of the let's say severe complications of the disease, a negative correlation. And of course, the young population we spoke about, which is clarity. Another unknowns on the negative side are obviously to what extent can you ramp up your healthcare, sort of the healthcare system capacity, the poor sanitation, the reaction of TB and HIV positive patients that are not on antiretroviral. And of course, poor, let's say, rural communities that don't have access to a high level of sanitation could prove to be a big differentiator on the negative side, unfortunately. Okay. So we will be tracking these variables in the next few weeks and months to ensure that we fit them into the prediction as they unfold. Okay, let me hand over to Anneline for this second section, and she's going to tell us a little bit about how what the consequence from an economic perspective could be in South Africa specifically.
Okay, thank you, Lorenzo. Can you hear me well?
Yeah, perfectly.
Perfect, good. So good afternoon, guys. So the first part of my session is to actually just drive you through a more holistic view of the economic effects. So if we look internationally, particularly in the March, the US unemployment spiked to 6.9 million. So this is quite significant because this is the largest peak where most Americans, so the most amount of Americans have actually lost their jobs all at the same time. Cumulatively, this is around 20 and 700,000.
I'm not hearing Anneline well. Is it just me? Or? No. We're having some issues on our side. Annelie, your line's pretty bad, but let's carry on. I will interrupt if it gets too bad. Give it a try. Give it a try, Anneline. Last try. Otherwise, I'll take it. I'll take it over.
Okay, perfect. So I'm trying again from a different Wi-Fi system. Just let me know or cut me off if you can't hear me. Okay. So if we look at this from a China perspective, what's interesting about China is that their industrial growth contracted for the first time by 6.8%, which is quite significant. So let's put this in South Africa. If we look at sales of the Yoko platform, so the Yoko platform, if you don't already know, is a platform that allows you to do transactions in small businesses. And a week before lockdown, these transactions dropped by 15 to 30%, particularly within retail and hospitality. And surveys done within the Cape Town region of small businesses, 95% of small businesses say that they cannot afford to pay their workers during this period. And 50% of them believe that they do not think that their businesses would survive this lockdown period. Economic effects are quite staggering. But if we look at China and their journey through this post-COVID process, it's quite reassuring. So if you look at China today, after 6 weeks of the outbreak, they've started to pick up production. So the right-hand side of this slide, where we look at coal consumption, what's interesting is that coal consumption actually picked up to what was 73% in 2019 to 62% today. Okay, so that it shows that there's some movement. If you look at the real estate transactions, it's picked up to 47%, which shows that there's improved confidence amongst people. That being said, if we look at how scenarios could unfold in South Africa today, we're at a point where we could potentially release this lockdown. And taking into account what Lorenzo has just mentioned regarding tracing, also looking at China today, what's interesting is that 1,700 cases in China have been reported in the past 3 weeks. Okay, and this is around 2% of their total cases. And this happened primarily during the release of the quarantine and lockdown period. So if we consider this fact and the fact that South Africa has not ramped up their testing as fast as South Korea during this lockdown period, the question we have here is, are we going to unravel some hidden cases during this post-lockdown? As a result, there's going to be a change in people behavior. So people are going to become more health conscious. They're going to try their best to distance themselves in order for them not to attain this virus. So there's going to be more access to e-commerce, there's going to be distancing from social leisure, and access to e-health, which we can see today. But at the same time, government is going to try their best to regulate this and mitigate the virus spread further post-lockdown. And this could be done in various ways. So one is to improve hygiene control in public and private areas. It can also include the control and monitoring of flow and people, which we can see in Wuhan today, having strict travel requirements. And lastly, there could be massive reassuring of value chains. This we see in Japan today, where they've promised $2 billion to actually assist multinationals leave China. Okay. What is the impact of this to our industries? So this is going to impact industries that are highly dependent on flow of people and highly dependent on social gatherings, meaning it's going to impact tourism, mining, manufacturing, and retail the most. Okay? In tourism, it's going to impact the most because we see our consumers focusing more on local and remote attractions. In mining and manufacturing, this is going to be a situation where the workforce is going to be controlled in terms of hygiene and monitoring. And as a miner, this means your OPEX cost is going to increase quite significantly. There's also a possible shutdown should workers contract and spread the virus.
Yeah, maybe Anneli, just let me sort of make one general statement. I promised you a good news, a bad news, and then a good news again. I mean, we are now unfortunately at the bad news. So the bad news is that this, from an economic standpoint, as you've seen in the first data, and then we're getting into some scenarios, will have a very, very severe effect, and is going to have most likely some shifts in how business decision makers and consumers make decisions in the future. So this is something that from an economic standpoint needs to be looked at very carefully and taken seriously.
Okay, good. So taking this to account, we see scenarios passing in 3 different directions. Okay, so in scenario 1, we see a situation where government does progress in flattening our curve. Okay, so the lockdown mitigation effects work, and strict social distancing occurs. So government enforces very strict social distancing post the lockdown. And as a result, we see a phased approach happening, in which case government will decide to phase industries up to 50% of their capacity. over a 14-day period. So I don't have a 21-day lockdown and we have a 14-day extension. So here we see a phased approach for an additional 14 days after the 30th of April, okay? And this will occur only in a situation where government feels that the critical cases are less than 200, meaning that our health capacity is not strained. There's a potential second scenario that could occur. Here we see hotspots and occurring in specific areas, and these hotspots have been identified during this remaining period of our lockdown. In this regard, government's going to be a little bit more cautious. So here we see a cautious and almost slower release after the 30th of April. The government will have a phased approach in specific industries, releasing to a capacity of 30%, at which point there will be a slow recovery period. In this scenario, we also see massive social distancing and strict regulations of inflows and outflows by government. Okay. The last scenario that we see post-lockdown is potentially government enforcing social distancing measures, however, having difficulty managing people to adhere to these regulations. Secondly, because of the slow ramp up of tests, there are potential hidden cases that would come up, creating hotspots in specific clusters of South Africa. And as a result, there could potentially be multiple lockdowns in specific areas and hotspots within our economy and location. So there's going to be a staggered release of 30% capacity over time, but at specific points in time post-lockdown, specific areas within South Africa could potentially be partially locked down. What does that mean in terms of economic effects? So here we see basically in scenario 1, we have the best case scenario of a medium phased recovery after 30th April, having a 7% contraction of our GDP. Okay. In terms of recovery, this means that South Africa could potentially take up to 3 years to recover at least 80% of this loss during this time. In scenario 2, where hotspots do appear within this lockdown period and we slow down this phased recovery, that could hit a 9% contraction on GDP, meaning it would take us up to 4 years to potentially recover this loss. And lastly, if we see these hidden cases, as Lorenzo pointed out in his first section, actually infecting our population with further lockdowns, we could possibly see a retraction of 11%. And it would take South Africa 5 years to recover at least 80% of that loss. Okay. If we had to compare that in terms of industries, what's quite significant here is that the financial services industry would probably be cushioned the most, because there's a potential for this industry to actually move sales, almost like an omni-channel, into digital services. Okay. So we do see a downgrade expected, an extra stress on the banking system. We also see a decrease in consumer behavior to soften the blow. In wholesale and retail, this is where we see a significant retraction in growth. Potentially, recovery is up to probably in 7 years. This is because consumer spending will drop, social distancing restrictions will limit the flow. Potentially think about a restaurant that's doing social distancing. Tables are going to separate at specific levels, which means that your capacity that you can take is quite limited. And the last contraction that we see, which will be quite significant, is in mining and quarrying, mainly because of the fact that it's linked to large workforces. Here we see large OPEX costs because miners will need to manage the hygiene and the safety of their workers, consistently monitor and test for COVID viruses. There are potential additional lockdowns which could occur in this industry should a virus be contracted by a mining worker. So it's quite at risk. Good. So I think, Lorenzo, I'm going to leave it to you to go into what does this mean in terms of businesses and consumer behavior, and how can local businesses react?
Sure. Thanks, Annalene. So I think, as I said, I promised one good news, a bad news. We've been through that, and the final one is if you want a good news. Not to say by any sort of stretch of imagination that this is, let's say, a good situation to be in, but I think what we see, not only, let's say, conceptually, but also empirically by looking at other regions, and now businesses are evolving, adapting, and changing, is that there's actually a lot one can do as the business leader to get through this with the least possible damage, and in some cases actually with some competitive advantage. So now, point number one is making the right decisions now is of utmost importance, and it requires a daily tracking of the leading indicators that are important in your business, that start obviously from the macro economic situation and how it's unfolding. Why daily? Because things are changing daily, if not fast. Team, you can call it a war room, a SWAT team, whatever you wish, but it needs to be fast and rapid decision making with fresh information. First and most important thing to intake is, at any point in time, build your perspective on the depth. And we gave you a little bit of our perspective on the impact on South Africa, but that obviously needs to be translated into your business. And that clearly depends on your view on the extent, the severity of the dip, the width, and so the length of the impact, which clearly is driven by things like a lockdown or a partial release or regulations, as well, which in turn are influenced obviously by the number of cases, number of deaths, mortality, etc. And then the shape of the bounce back, which again is very heavily influenced by the reaction that governments, especially, and partly also businesses, put in place. So I'm talking about fiscal stimulus, monetary stimulus, etc. Okay. So if you try and look at sort of your personal or business situation, you can think of it in sort of a matrix type of way. The way we would look at it is the types of actions and work streams that you will be looking at depend very much on two things. One is the stage at which you believe your business is at vis-a-vis the crisis. So are you in the fall, and how deep will be the fall? Are you in the turnaround phase, or are you in the bounce back? And then your company financial health, quite clearly. So here we're not talking about P&L health, we're mostly talking about cash flow health. This is about the liquidity and the strength of your balance sheet, your ability to leverage. Now let's move into the next slide so we can give a little bit more context on so we've seen amongst our portfolio companies that we've invested in over the years and that we follow on a day-to-day basis in this particular period, and also with our sort of corporate clients and in boardroom discussions and with CEOs, sort of the four most, if you want, adopted, if you want, work streams are the four on this page in this phase. I mean, number one, we spoke about a little bit already, which is basically the dynamic scenario planning. So identify a small SWAT team of people you trust that gather fresh data with a very relatively simplified dashboard of key leading indicators, and make up scenarios on a ideally daily, if not weekly basis, that go down to your cash flow impact, to your P&L, and therefore from there the cash flow impact. So if this happens, what happened to the cash flow? If that happened, what happens to the cash flow? Now, that's sort of the what we call the dynamic scenario planning. The second one is aggressive cash preservation. I mean, this is again extremely vital before you think. So rather than sort of, you cannot undo expenses, you cannot undo certain decisions. So it is of utmost importance that in this phase, cash preservation becomes priority number one, especially if you're either in the yellow or in the red in the previous slide. Now, this obviously takes different phases. It has a working capital aspect. So it's about, can you renegotiate receivables in order to get them, perhaps offering discount to get them in earlier? Can you renegotiate payables? Can you, do you need all of your inventory? Can you lower your inventories in some parts of the value chain? It obviously has to do with revenue preservation. So can you make your and revenue preservation and also the sort of costs of your, I mean, your general sort of cost base? Can you renegotiate some of the contracts together with your suppliers in a way that it's a win-win, that if you survive, your supplier will survive, and vice versa. So I mean, constructive conversation in this phase are actually usually quite effective. There's obviously a financing, let's say, lever, which is all about where can you access capital quickly, even if you don't need it today. The third sort of most, let's say, if you go back to the third most important, let's say, work stream is leading teams in crisis. I mean, this is very much trying to handle the following problem. People panic in uncertainty. If you take that and you sum on top of that remote working, this is a terrible recipe. So rather over communicate, be extremely transparent, and extremely, let's say, extremely transparent and extremely genuine in your communication. This typically is very much appreciated and extremely important in times of crisis. And then the fourth one, which is unfortunately only for the, let's say, let's call it the lucky ones, or the ones that are in the lucky position of actually having a relatively healthy balance sheet for the months to come. I mean, not only, but certainly more so for those businesses. It's about, I mean, number one, there will most likely not be in our current generation any opportunity to this extent to possibly do good value for money acquisitions out there. So if you have the balance sheet and you can afford it, this is the time to start scouting the environment and looking for potential M&A opportunities, whether it's joint ventures, full-fledged M&A, or even just sort of minority acquisition. Digitization is certainly something that, I mean, on the one end is falls part of what we call the post-COVID better you, but on the other hand, we know by now that digitization, if we had any doubt about the speed of digitization across industries, right now we have the certainty that this will be fast and a lot faster than it was before COVID. So there is absolutely no fooling oneself in any businesses when it comes to digitizing as much as you possibly can your operation. So be state of art. And then in general, I mean, some businesses are also taking this opportunity to rethink their business model or their business strategies from the bottom up. So in other words, if I were to start a business that is in this field tomorrow from scratches with almost zero constraints, what would I do? How would I sell? What would be my route to market? What would be my business model? What would be my pricing, et cetera, et cetera. Okay. As I said before, I think, let's say, there is also trying to take this threat and turn it into an opportunity for as much as we possibly can. I think it's important that we understand deeply the changes, the shifts that are not only, I mean, the page before is a page that basically refers to what can you do in the immediate future? What can you do as a business tomorrow? This page touches a little bit more upon what will change, that will be a structural change that will stay different forever after COVID, or a trend that will increase in speed to an extent that your business needs to adjust to it. And we tried to sort of cluster it in a few drivers. Now, obviously, the culprit is the coronavirus. The drivers that will follow from it, there's a regulatory driver. So think about, for instance, new privacy laws that will be, I mean, privacy will need to be thought about quite deeply. If you think about how people have been monitored in certain countries and so on and so forth to be able to contain the virus, and that will have been done by the end of this, not only in China. So that's certainly an area that will create space for, would create change. We by now know that the healthcare system is globally inadequate to tackle anything even remotely of this size of magnitude. There's definitely a geopolitical shift. I mean, we've seen it before with the trade war, even before COVID. What will happen to the geopolitical equilibrium after COVID? You know, will this be a world that sees China more as a protagonist? Possibly. Certainly, that kind of, let's say, those kind of that kind of management and those kind of let's say strict policies facilitate somebody to get out of to manage a pandemic like the one we're living. Clearly, we'll see that countries that are able to now borrow and spend, i.e. the US, think about the $2 to $4 trillion package, which is roughly 20% of their GDP. Those countries will have a massive advantage over other countries. There's absolutely nothing that changes that, or that can change that. So here the big question is, how can South Africa tap into some extra funding to ensure that we fill the hole that otherwise will be created in the economy and will sort of have second degree and third degree and fourth degree effect afterwards. Consumer behaviors will change, spending, much more focus on the necessities. This will most likely slowly then fade away, but certainly there will be a few years of focusing on the essential. Omni-channel, news shopping channels, digital content consumptions will change completely. All of this will create a massive amount of investment in industries. We mentioned before the digitization. I mean, think about smart working. It was inconceivable before, or almost inconceivable in 80% of businesses globally. Now everything has changed almost overnight. Think about that going forward. Think about e-learning going forward. Think about that in connection with actually the need to re-qualify and retrain people, because some businesses will be a lot smaller in the future, and some businesses will actually require a lot more people in the future. So think about the need to requalify people together with this e-learning, let's say, industrial shift. Think about health and hygiene. In digital health, again, we didn't need COVID to start this, but this will see a massive shift in gear. And all of these drivers, which will generate this industrial shift, will very likely create new winning segments within industries. So it's not just going to be about healthcare. It's definitely, I mean, certainly the emphasis on healthcare will increase, and there will be most likely a component of healthcare in every business to some extent, certainly the ones that are very people-facing, whether it's customer or employee-facing. So we will likely put a premium to add-on services that have a sort of extra sort of cleanliness, hygiene components. It's a very real possibility. Think about e-commerce. I mean, omni-channel will be the only strategy. So e-commerce with actually contactless deliveries will certainly take up. Think about, with all these and internet that I mentioned so far, the speed at which we will need 5G infrastructure in the country and globally. Think about warehousing that comes from having all these online and different delivery channels. Think about the need of a bank branch after this. Think about, I mean, this was, again, a shift that was already happening. Think about the speed at which this shift will happen post-COVID. So think about fintech and insurtech. Think about the speed at which banks and insurances will have to evolve towards this direction, and will want to evolve towards this direction, and will win if they evolve quickly enough towards this direction. Digital entertainment is another example, and medical technology that I think are also quite, let's say, self-explanatory. So I think, let's say, overall, maybe Annalene, you can move to the last page. Unfortunately, we went a little bit longer than we anticipated. We wanted to leave you with a little bit of hope of, let's say, you know, understanding these future shifts can actually enable your business today. But now we would love to leave it to a couple of Q&A, which we are happy to take also out of the context of this webinar.
Okay, I see some questions already.
Can I kick off?
Sure.
I'm going to see if I can share my screen. Here goes. Okay, so what I want to deal with, and what I'll ask you guys is we're dealing with a 2 to 8%. We hear about mortality rates, deaths, and the like. If I look at closed cases, I see 700.
Maurice, I don't know if it's me, but I'm losing you.
Yeah.
Can you hear me? Can you hear me now?
Now we can hear, yes.
Okay, sorry about that. I'll start again. What I was saying is if you look at the screen, you can see there's 707,000 closed cases with 148,000 deaths and 558,000 recovered. That means a 20% mortality rate of 707,000 people who've got it and their cases are closed. I'd ask that you comment on the 2 to 8% mortality rate that epidemiologists are banding around, because I've researched it. And for instance, the mortality rate is mortality in relation to an entire population, whether they get it or not. So my concern arises from the fact that it's actually a 21% mortality rate when one has regard to the outcomes and not the 2-week lag. I was hoping you guys could comment on that.
Yeah, so just a few things here. I think what we've looked at in the study is the infection mortality rate, which looks at the number of people that are infected and the mortality rate based on that. And the reason why you see differences between what's reported and what's in science is a few points. So one is that if you look at past epidemics, for instance, the SARS epidemic and the H1N1 influenza, what's quite interesting is that there are 3 weeks between somebody that is developing a symptom versus somebody that's observed to actually be symptomatic. And this is what's a lag between who actually has COVID and who's been screened to have one. The second point is really about the scale in which you test. And this is why the Iceland scenario and the case of the Diamond Princess, which is what Lorenzo mentioned, is so important. Because in these scenarios, especially the Diamond Princess, every occupant of the ship was actually tested. So this is almost like a little case study where we can see if you test everyone in the ship, it's most likely there are more people that actually have the case than we have been reporting.
Just to leave a little bit sort of time to also perhaps for other questions, I would say, but really the real sort of one-liner is lots of untested cases, so people that are actually infected but we don't know, and a lot of asymptomatic cases. That's the reason why these numbers look so high, but in reality are a lot lower.
Great, Lorenzo. Whilst I got you on, there's a question by Temba. Contact tracing and use of mobile technology tools has been the biggest sources of South Korean intervention response. Are you aware of the available tools for the Republic of South Africa to replicate the same?
Yes, it's quite interesting because South Africa is using similar type of approach today. So we've actually kicked off GPS tracking via mobile devices to do contact tracing for the cases that they've looked at. This needs to be matched with mass scale of testing. So if you don't know what's out there, you can't trace contacts. But in terms of looking at our tracing versus other countries, we are moving towards best practice similar to South Korea. The reason why it's not so big in other countries is simply because of privacy laws. And government made a very quick and swift decision to mitigate this and use mobile testing.
Great, thanks for that. We don't have any further questions that I can see. So I'd ask that the audience please post questions because we're about to conclude. Whilst we wait for questions, I'm going to take you through again. COBRA is a partnership with YPO and the partners behind me. The idea is that we're going to be having these webinars not only every day, but more than once a day. We've got a lot of support from really, really unbelievable partners. And as I said earlier, we're indebted to them, and in particular YPO. Thanks to the audience. I don't know if the panelists have anything further to add. Do any of you? Adam?
Nothing
we've
from
got
me.
a question. Sorry, before you go on, Adam, I have a question for the other panelists. Have you factored in the slowdown of China post-COVID? I think that's a good question.
Yes, absolutely. I mean, let's say the beauty and at the same time also the bad news in an interconnected economic system is that now China sees most likely a very quick recovery, but then they would see a slowdown because all of the countries that demand products from China will slow down because they are in lockdown and because they are in post-lockdown. So in the modeling, you need to take into account of the first degree effect and the second degree effect.
Great. I think that's pretty much wraps up. Thanks to YPO, thanks to Adam, and thanks for making the time. Bear in mind, wait, we may have a question. How long do you expect the coronavirus to be in until September? Well, if I can, I'll give you my view on that. I think the future is so opaque that it's actually not even worthwhile making a call. If I were to make a call, I'd say it's post-December, purely because I read an article which dealt with Trump and his policies in relation to the uneasing. And the question arises, what can Trump do about human behavior? Because humans are not going to go out there when there is a risk. So that's beyond our control. So as of September, if the lockdown is uplifted, then it begs the question, does that mean people will find themselves on the street? I certainly know that I'm going to be taking extra precautions and I will not be going out there that quickly. I don't know, Lorenzo, do you want to comment on that?
Just a quick comment, I agree with you. I mean, the most, let's say, credible scenario that we see is a number of multiple waves that are ever smaller. So in other words, this virus is here to stay, like every yearly influenza. They're here to stay. This one is just unfortunately a little worse than the yearly influenza, and it will go away in smaller and smaller and smaller waves. Unless, of course, there is only one or two wild cards. One is the vaccine, of course, if it doesn't mutate, because if it takes less than a year to mutate and it takes us more than a year to get the vaccine, we are back again next year. And the second one is obviously if we find a good mix of drugs that at the very least can limit, let's say, the complications, which is really what has people, the respiratory complications. So barring these two wild cards, it's here for the long term. It's going to be a 12 to 18 months game, but it will more than linearly get better and better over time. So there's nothing from a virus perspective. It's less worrying than the media makes us believe.
No, certainly. And there are news reports. There's a drug I was looking at now that's been through a limited trial. I think it was 120 people, and they say that most of them responded really, really well. In fact, only one person with advanced stage COVID died. So there are those prospects that, as you call them, are the wild cards.
And another wild card, maybe just to conclude, which I think is extremely interesting, and it's a nut that nobody has cracked yet, is why in the Southern Hemisphere the number looks so much smaller. So, whether it's climate, whether it's the BCG vaccine, personally, I'm convinced that we will find out in the next few weeks, maybe months, that there is a factor that makes, and I'm hoping that's the case. Obviously, it's not proven yet, but empirically, it seems to appear so, that will make that is making right now the southern hemisphere substantially less affected than the northern one.
Well, whilst I've got you on that, let's assume that is true. That appears to be true. I mean, then there would be a prospect of South Africa become a breadbasket for the rest of the world, or Africa a breadbasket for the rest of the world. Can you comment on that?
Yeah, absolutely. I mean, this could be an excellent opportunity. I mean, obviously, you know, we've seen the reverse of that in Italy. I mean, I'm physically, actually, I live in South Africa, but I'm physically in Italy right now since the lockdown, and we've seen the reverse in Italy. So countries that are considered high risk are not accessed by the rest of the world, are not supplying the rest of the world, and so on and so forth. So obviously, the opposite also is true. So this would give the Southern Hemisphere, and in particular, in this case, Africa and South Africa, a massive opportunity. Right now, it's too early to tell and too early to be, let's say, too joyful, and certainly too early not to continue to be careful. But I think there is some hope. We just don't know exactly why, and we just don't know exactly to what extent.
Lorenzo, I'm going to just conclude with one final question, and that's in relation to the opening of the mines. The way I see it is actually possibly a clever move, because the mines can be essentially quarantined in themselves. They can be quarantine communities, and with the gold price going up, this may be a fantastic opportunity for South Africa if it gets it right. Can you comment on that?
Yes, I mean, look, let's say what certainly has been proven throughout history in a number of occasions is that if the economic, over a certain reaction point, the economic consequences of strict regulations like lockdown can become a lot worse than sort of the disease. The disease certainly for instance, in this case. So it's important that we find the right balance between the measure and the risks that we run if we don't take the measure. In particular, on the mining sector, I mean, my perspective is that if one was able to implement in a very strict manner, extremely severe and strict sort of hygiene rules, especially when it's not, when it's a little bit more mechanized, a little bit more automated, a little bit more potentially open cast instead of underground, certainly I would be in favor to let's say, take that opportunity as soon as one can possibly do it safely, which seems to be done right now. So I'm happy about this news. And I think this will create, again, an opportunity, because remember, the world is in lockdown. So a lot of the mines, for a lot of the commodities you see, for instance, take the price, for instance, I'm just taking one example because it's a small market and it's constrained quite quickly. Take uranium. Because of a lot of the mines, the demand is stable because you need to take the nuclear plants, keep the nuclear plants running. On the other hand, the supply is heavily constrained because a lot of the mines are closed and you see the price spiking. So obviously the ones that are able to supply will make fantastic profit out of that. So this is not to say that we should not be, let's say, I mean, it's people's health first, but certainly if we can guarantee the safety, this is an excellent opportunity for South Africa.
Lorenzo, I'm indebted to you. I'm indebted to Annalie, and I'm indebted to YPO, as is COBRA. Thanks to all of you. Thanks for making the time. It's a Friday afternoon. Have a fantastic weekend, and we hope to see you all on Monday, 10 o'clock. Thanks, guys. Thanks to the panelists.
Cheers.
Thank you.
Be safe, everybody.